Thank you so much for your kind introduction, and say hello to Dr. Friedman. I saw she was also on the call there. Thank you everybody for reaching out and helping me be a part of this awesome group here today. I know I shared the slides with Michelle. Do you want to put them up for me? Do you want me to go over that, or do you want me to?
So, Dr. Srinath, why don't you, if you're comfortable, you can run them yourself?
Actually, I don't have them up right now.
Oh, okay. Let me pull them.
Helen will bring them up for you.
Okay. So, anyway, I can get started just talking about what I do as a physical therapist in the acute care in the hospital setting. So, physical therapists practice dry needling or educating the patients with therapeutic exercises, both in the hospital setting and in the outpatient setting, and also do what we probably will talk about 3 different areas that I would help a patient who comes into the hospital with migraines, which would be therapeutic exercises, dry needling, and what is also called cervical traction. I was so happy to see that Margot introduces some of the techniques that we expound on in the physical therapy arena. She talked about the neck stretches, giving that traction kind of stretch. So we do some of that, and we also complement a few more exercises along with our other modalities. So when we get an order from the doctor, especially Dr. Friedman, we go in and talk to the patient and at length about her or his like postural habits or his profession. What exactly is causing these headaches, and how long have they had these headaches, and what is their purpose and what is their goals with physical therapy to help them through this rehab process or through their recovery process in headaches. So the first thing that I see that when I was talking to Helen, she said that dry needling was not something that was not everybody was very familiar with that approach. So I thought maybe this is a good way to get some of you acquainted to this process, and then I can run through some exercises too. Do you want me to wait for a minute, Helen, to pull up the slides, or?
I am good. So I'm going to share my screen so that we can see it. And you can just prompt me to move the slides when you're ready.
Okay. Thank you so much. So go ahead and pull up the first one, maybe the roadmap, I said. Yes, yeah, you can go to the next slide. Okay, so like I already talked about this. So yeah, the emphasis today also I want to pay an emphasis to the muscles that we target for the treatment of migraine headaches. So the next slide, Helen, please. Yeah, so like I said before, what exactly is the roadmap? How do I get started with treating some of these patients with headaches, migraine headaches specifically? Okay, the next slide, Helen, please. So gathering patient case history is very critical because it helps me plan, form an assessment, and plan my treatment plan to give them the right modalities, right exercises, and educate them on posture, and move on from there. Okay, the next slide, please. So, okay, this I already spoke to this one. So next slide, please, Helen. This is just something that I would have collected from the patient, this range of motion of the shoulders and neck, and what does their posture look like, what does their strength look like, how do they walk, and how do they move out in and out of beds or different settings like in and out of the chair. What does their posture look like when they do all of these activities? Okay, next slide, please, Helen. So here, this is something, if most of you are not familiar with, I would like to take a minute to introduce you to dry needling in this population. So what is dry needling? As the name itself indicates, we do not deliver any medication via these needles. It is a therapeutic modality which is used for soft tissue dysfunction. And what is soft tissue dysfunction is tightness, myofascial trigger points. You could have inflammation, inflammation from prolonged wrong postural habits, or your job that requires you to do something repetitive, which causes inflammation in certain tissues, or if you are a runner, you don't stretch enough after running, you could end up with some soft tissue inflammation in your gastrocs, hamstrings, which I will go over that in a little bit about how it can trigger some of the headaches too. And then tissue adhesions, like after you've had some injuries, so you've been in a motor vehicle accident, you probably had some whiplash injury, and you've had headaches since then. So looking at all of that, and I would see if you are a good candidate for dry needling, and then use that as one of the modalities to treat the patients with headaches. And just some ideas for you, for the population to understand that dry needling is similar. I just saw a question from Jamie that is it similar to acupuncture? I would say that it is similar in the only similarity would be that we use the same kind of needles that acupuncture and physical therapists do use. But acupuncture actually, they go with the meridian system, which is a concept of the traditional Chinese medicine, which follows a path, and they believe that there is a path these meridian systems follow through which the life energy flows. So there's a little difference where they would use these needles as opposed to where I, as a physical therapist, would use. I would go more musculoskeletal. I would palpate for trigger points. I would palpate for tight muscles. I would look at posture of a patient, which probably caused some tightness in some muscles, and that's where I would intervene, whereas an acupuncturist would follow the meridian system. I hope that helped answer that question. The next slide, please, Helen. Okay, so what is the target? Like, what is the objective of dry needling? So ideally, when you have tightness in certain muscles, you have disturbed the homeostasis. What exactly is homeostasis? It's changes in the tissue level. Like, it's not something that is visible to you and me. You probably will feel like the tightness, but you don't really see what changes are happening in the cellular level. So when I use dry needling to a certain muscle or to a certain trigger point, my hope is that I make a change in the homeostasis, not only in the tissue, like the local tissue, but also in the systemic, like overall, it helps. It helps release the physical stress and also the physiological stress in the area. Next slide, Helen. So some of the therapists who practice dry needling also use electrical therapy along with the dry needles to cause more of a change, like a rhythmic vibration to the tissue, which should help increase the blood flow to the area, which will then decrease inflammation and help with self-healing and self-repair. That is the idea. That's this idea behind dry needling. Next slide, Helen, please. So like anything else, any other modality, as we all know, there are limitations to dry needling too. So if the condition the patient is going through is past where dry needling could help, then you would see that this patient has less relief from dry needling. If the pathology is very severe, that's what I was trying to say, then maybe dry needling would not be very effective. So the next slide, please. So what are some of the risks? So as a physical therapist, it's very, very critical for me to understand where I'm going to needle this patient. Like, for example, if I was going to do the neck, I need to know that right here, just behind your ear, your vertebral artery runs there between C1 and what is called the mastoid process. So when I dry needle, I better make sure that I don't puncture the artery. Or if I am going to needle the upper tract, I need to make sure, because the apex of the lung sits right there. The top of the lung sits right very close. So if I put in a needle that is too long and and I don't position the needle in the right direction, I could cause what is called pneumothorax, puncture a lung and cause pneumothorax. Then patients who have had syncope, that means like sudden loss of consciousness, they would not be a candidate for dry needling at that point. Once they recover, maybe. Then hematoma, if there's muscle bruising because of motor vehicle accidents, if there's muscle bruising there, or from the hamstring strain, if there's hematoma from anything in an area, I would not be dry needling that area. If they have infection going on, like I would not be doing dry needling. And then edema, muscular, if there's a lot of swelling in the particular muscle, I would not be dry needling that muscle. And any nerve injury or insult to your spinal cord, if they have poor sensation in an area, I would not be dry needling that area, because the patient's not going to be able to give you the right feedback. Next slide, Helen. And absolutely no dry needling for some of these areas, like I've mentioned here. Anyway, that you have an open wound or a broken skin, any kind of cancers, any kind of aneurysms, where there's an abnormality in the blood vessel, and then hematomas. Arteriosclerosis is a plaque in the blood vessels. The reason being, you have to be careful that anything that you do does not cause that plaque to split and cause maybe a DVT, or going like to your lung, cause a PE. So you just have to be careful about that. So you wouldn't be doing that. And of course, osteoporosis, if their bones are not in the right position to hold the patient upright or give them the stability, I wouldn't be dry needling them. And then prosthetic implants, like for example, if some patient comes to me and tells me that she's having a lot of knee pain, but she's had the total knee replacement, and it's depending on how far along she is in that process, I would not be dry needling her knee area, because that could cause some infection, increased risk of infection in that area. Okay, the next slide, please, Helen. So this is the critical area that I want to address here today. So what are the muscles that I look when I talk to a patient, and what her symptoms match with what I'm looking? So for example, did we skip the first slide, the one previous to this, Helen? Oh, I think you're going down. Can you go back up? One slide, next slide, next. Sorry. I think it went back. I was looking for that slide that talks about occipitalis, frontalis, and the upper, this one. Yeah, hold it right there. Thank you. So most of the patients that I see complain of headache, tension headaches that they experience just right here or right here. Like Margot was talking about some of the massages that she was talking about, she hit the areas that I would be dry needling. For example, your occipitalis is the muscle at the back of the head. So you get tension headaches in this area, because of the spasms of the muscles. And also, believe it or not, if you have tension in your hamstrings or the foot, because of how fascia is like this connective tissue that binds muscles, nerves, and blood vessels, and it is something that is continuous in your body. So it could be something that comes all the way down from your hamstrings, all the way up the back of your head. could also be causing some tension in the head, in that area, causing headaches. And tension headaches right here too, because of the tightness of the fascia back there. Then your upper trap, like I was talking about, we all know that we carry a lot of tension in this area, in your upper trap area, that would also be causing tension and headaches. You would feel a lot of pain in the back of your ear, you're feeling pain around the eye. So these are some things. So I would be going ahead and, like, you know how Margot talked about rubbing down here by your ears and by your temple, which is the temple. Next slide, I can talk about that. This one is the temporalis muscle. It goes all the way from the front of the ear to behind the ear. So I would be dry needling that area. And also the masseter is right here. So if most of us, like for example, if I'm somebody who's on a computer 8 hours a day and my head is forward like that, and I am typing or whatever I'm doing, this is called the forward head posture. This will cause these muscles to shorten, this muscle to tighten, and that could lead to some of the migraine headaches. So you would also feel with the masseter, or even the temporalis, if somebody has the habit of chewing gum all day long, would cause strain to this muscle right here, which is the masseter muscle, or your temporalis muscles. So, you know, your lifestyle changes or your lifestyle itself could be the cause of the headaches. Then I would address lifestyle changes and what they can do to help with that. And then I just have a video, real quick, few seconds for you all to watch about how dry needling is done. Then I will go over some exercises with you all real quick. I don't know how much time I have, but would you like to play that, Helen? Just click on that. I think while you're trying to play that video, I can respond to somebody's question about Botox, acupuncture, dry needling. I am not a medical personnel in the sense I'm not a physician. So Botox is something that I definitely have nothing to do with. The physician would be talking to you about it, and it's definitely a medication that's delivered via a needle. Whereas dry needling, I do not deliver any medication via those needles.
Great question. So let me just ask you, you must not have been able to see my screen when I started the video?
No, we could not.
Okay.
But it's not important. It's okay, I'm sure. So I just picked up a random a video. Anybody can go onto a YouTube website and look for dry needling for headaches, and there are tons of
to see the
videos
details
that are available. So I can start off with my exercises. It'll be much more beneficial, I would think, because that video can be, anybody reach for them.
That's perfect.
Okay, so if just like what Margot said, if anybody wants to join me with these stretches, please feel free to stand. So the big thing that I was talking about is the forward head posture, how I would correct that. So I would tell the patient to come out, get out from the bed, follow me to the wall. So bring your heel to the wall. Now bring your shoulder to the wall and bring your head back to the wall. So if I were to draw a plumb line from here, from the top of my head, it has to cut through my ear, shoulder, hip, knee, and ankle. And then when I leave the wall, I come out without moving anything. And that is the posture I want them to maintain all through the day. Thinking about when they're working at the computer, make sure you have the setup of the computer appropriate. So you have your arms up, you are about 20 inches away from the screen, and you are sitting up with your head back, shoulders back, hips, all in alignment. So that's my first thing. And it's, okay, so that's posture. Thank you, Dr. Friedman, for taking that question. Then we have neck retractions. So the next exercise I would do, have them stand up there and gently push your chin tuck in. Tuck in your chin. So these muscles that are tight back here, no matter what you do, you cannot get to them because they're such deep sub-occipital muscles, we call them. So I would say, pull your chin in and hold it there. Pull your chin in and hold it there. So those are some gentle stretches for the deep suboccipital muscles. Then let's look at shoulder circles or shoulder rolls. I would say drop your shoulders, bring them up, roll them back, bring them up, roll them back. This is to decrease the tension in your upper traps. So circles backwards, and I'm sure many of you have done this in any of the yoga classes or Pilates classes that you've gone to, and that is really helpful. So even during the day, while you're doing whatever you're doing, take a few minutes to do that. Take a few minutes to reassess your posture. Are you in the right place? Then the next one is shoulder shrugs. Bring it up, and then take a deep breath, and then drop it. And then, so critical for you to remember what is called the diaphragmatic breathing is when you take a nice deep breath, you should feel your stomach expand, and when you breathe out, you feel your stomach like crunch, okay? So that is very critical for you to remember when you are taking nice deep breaths. So again, and then, so when you're doing your shrugs, and then, so breathe out by tightening your stomach muscles. Okay, I hope I'm not going too fast, but I don't want to take too much of Dr. Friedman's time. I'm sure she has tons of important information to tell you all. The next stretch would be for your upper trap, which many of you, I'm sure, have seen that. So bringing your hand behind your back and bringing if I was going to stretch my left upper trap, I would bring my left arm behind me, reach up and over with my right hand to the left ear, and gently pull it down sideways. And hold. And then bring it down. And again, the same thing. If I were to stretch my right upper trap, I would bring my right arm behind me, reach up with my left hand over my ear, and then pull it sideways. There you go. That is a good stretch. Then another one is to release tension in your upper thoracic back, which is back right there by your shoulder blades. I would go ahead and clasp my fingers like that, and then slowly pull them away from me and tuck my chin to my chest. So again, I start off here, gently pulling my arms away from me, tuck my chin to my chest, and bring it down, and stretch your upper back. Okay? Any problems so far? Everybody, is the speed okay? Okay, the next one, just like we did chin tucks, I'd like to show you some to see our posture to correct that. So your shoulder blades, retracting your shoulder blades. Retracting your shoulder blades, you can do it in 3 different positions. The first one is your elbow by your waist. So keep your elbow by your waist. Keep your chin tucked, like I said before, and draw your elbows towards your waist. So waist level, pull it back and hold it there. Typically, all of these stretches, I start off with holding for about 5 seconds first. If it's not too painful, then I can go up to 10, 15, and patients start building it up to what they're tolerating. Then the next position is bring your elbows to your shoulder height, arms up, and again, same thing. Draw your shoulder blades together. Draw your shoulder blades together. And draw your shoulder blades together. And the third position would be your elbows above your head and drawing your shoulder blades together. Drawing your shoulder blades together. And I'm sure many of you know stretches for your pectoral muscles, which is this big muscle group right here, is what I call the doorway stretch. So if I have a doorway right here, an imaginary doorway, I put my palms on the doorway, I step into the doorway and lean away from it, pushing into the door frame. So that stretches my pectorals. So most of us who have jobs where at the desks or, something like sewing or, you're in assembly line jobs or anything else that you use your arms right here, tend to have tightness in this muscle area. And these doorway stretches are really, really a good way to release the tension there. Okay. I guess I'm close to, I have one more minute if anybody has any questions before I move on.
We do have questions for you.
Okay.
Do you want me to ask them now?
Yes, sure.
Oh, wait, 1 second. Oh my gosh, we almost left the meeting. 1 minute. Okay, let me get to them for you. Okay. You answered that one. Oh, is dry needling painful? We had one person respond that's had it, but what is the consensus to your patients? Do they feel that it's painful?
No, so it's not painful, but then people have fear of needles.
Okay,
They're just fearful of needles, and you will actually feel like a little pin. That's it. It's not even like a shot, like you go in to take a shot, it's not even that painful. You feel like a little ant bite, like a little prick, and that's it. But if you have a muscle that's really tight, you might feel a little tension in the muscle, but really the needle itself is not painful.
Okay. If patients do not respond to dry needling, you had said something about that. What would you recommend that patients try next? Do you make a recommendation?
So definitely, like if you tell me that the dry, so I treat the patient and the next day when I go back and they tell me, I don't think I did have much, it did much to me, but like 1 day is not a good way to assess if dry needling is helping or not. I would say give them at least 3 to 4 times. So that's what I do when they're in the hospital. I see them 3 to 4 times that week to make sure that it's helpful or not helpful, make a call. But if dry needling doesn't help, like I said, the stretches, I am very positive, if done appropriately and very diligently all through the day, will be very beneficial. And the another thing that I try with them, like I said, is the cervical traction. We have a portable traction unit that helps release the tension in the muscles, that I use that. And then if any of this helps, we as a therapist will talk to the neurology team, Dr. Friedman and her team. We communicate and say, you know what, she's benefiting from this and this and this. Can you give her a prescription so she can go to an outpatient center and continue on with this therapy? And somebody asked about needles. I don't know if you can all see this. This is a huge needle. This is like almost a 4-inch needle that I would use for somebody in the hip. Nothing, can you see that?
Oh, yeah. Mm-hmm.
It's so little. It's in a sterilized, like, a plastic cover, and the needle is just the top part of it. So I can open it for you guys to show you how exactly it is. So this is the little tube that it comes in, and I go in and tap it wherever I need to do that, and then release the needle, and then this tube is gone, and I just drive the needle into the area that I think needs that. So this is the tube, and here, this is the needle. If you can appreciate how skinny the needle is,
Oh, right. You can hardly see it. Yeah.
You can hardly, it's like almost like a little thick hair, you
Okay.
know, that's how, this is almost 3 inches. Okay, then I have, mostly what I use for dry needling will be these 2 inches needles or the 1 inch needles.
Great.
Okay,
Yes. Thank you so much.
yes.
All
Any other
right.
questions?
Wonderful.
Okay,
No, thank you so much. That was
thank
a
you.
very, very exciting presentation.
Thank you.
Yes. Thank you for the exercises. Thank you for everything.
Thank you. Thank you all for helping me be a part of this great team. Thank you.
Yeah. Thank you. Have a great afternoon.
You too.
And
Thank you, everybody.
yep, we will